Hello and welcome to the board exam study time for Physical Therapy Podcast, the best PT podcast. This is episode 1, an introduction to the podcast and some nitty-gritty details about the board exam. So first of all, talking about the podcast info, who am I? I am Alan Fredendahl. I'm a third-year student graduating in August, and I designed this podcast because for the past 8 months or so, I've had at least an hour-long commute each way on my clinical rotations, and I realized that I'm really missing out on a lot of study time for the board exam, spending so much time in my car. So this podcast will always be free. There will never be any advertising, selling anything, or any charge for it. It's something I've created to help myself study that I've decided to just structure and organize a little bit better and then pass it off to all you other students out there who are either also in the car a lot, going to clinic, or who may be auditory learners. So ahead of you are about 100 episodes of well-organized but relatively short. I try to keep most of them less than 5 minutes, organized by different types of intervention, examination of the different body systems. In organizing this, I've created a master outline using the FSBPT content outline, as well as both the Score Builders and Therapy Ed study books and in-person prep courses to create a very comprehensive outline. And then I've used all the different textbooks assigned in PT school and some notes on some more niche topics, such as the vestibular system and the TMJ. In the show notes of each episode, so if you're listening on iTunes or an Android podcasting app, if you click the more info wherever it may be, you'll find a Dropbox link to the outline for that episode. And if you're listening on YouTube, you'll find a link right below the video in the description to the outline. Whenever possible on the outline, I've included videos, pictures, and tables, with the caveat that this is copyrighted material, so just lifting stuff directly from textbooks and study material is not legal, even though this podcast is free. The podcast will be available on YouTube, as well as iTunes and Android apps like Podbean and Google Play. And as I've said, all the information is coming from a number of different sources. The FSBPT outline published online, all of the different study prep books, all the different textbooks assigned throughout PT school that the exam questions are pulled from, and a few notes from PT school. Talking a little bit more about the exam itself, if you have any questions about the exam, how it's structured, how the tests will work, what the testing center is going to be like, you can go to fsbpt.org and click on the very top left button that says Exam Candidates. So talking now about the test, I'll start off with saying that if you think you need accommodations for the test, they will allow extra time, either 1.5 times or 2.5 times the normal time allotted, so 7.5 or 10 hours, and you should apply for that as soon as you can, and to be sure that you receive them. The testing center is going to be a Prometrics center, so very likely this is going to be the same place that you took your GRE at. However, the security restrictions will be much more strict and severe. So you'll need to bring 2 forms of ID, 1 piece of photo ID, either a driver's license or a passport, and then 1 piece of ID with your name pre-printed and a signature. So a good example is a credit card. And when in doubt, bring too much, because it's just going to be thrown into your locker anyways. And an important note here is that Social Security cards are not considered forms of ID. When you get registered for the test, note your appointment time and realize that Prometrics requires you to arrive at least 30 minutes early to accommodate the 15-minute break built into the test, as well as a mandatory pre-test test tutorial and a post-test survey. And you'll need to be checked in and ready to test by the time listed as your test starting time. And keep in mind, these facilities can be very, very busy. There are many candidates that are also taking the NPTE, but there are also people taking other exams, just like when you were there taking the GRE. They may be taking the GRE or the MCAT, and this can increase the time you need to get checked in and do the tutorial and all that jazz. And then keep in mind that the testing center is going to be very busy at all times. So that includes checking in, as I mentioned, but also taking your breaks and receiving any help you may need, because these testing centers are going to be full throughout the day with people coming and going, taking different tests. You'll have a locker there, just like when you took the GR. Inside the locker, you'll store your phone if you bring it in. You'll store your extra forms of ID. You'll be asked to store any extra jewelry besides a wedding band or engagement ring, as well as glasses and hair accessories. So really the best plan is to just leave all that stuff in your car except the bare minimum of what you need to sign in to the test. You can bring food and drinks. When you access your locker during a break, you'll be observed, and you won't be allowed to remove anything except food or drinks, or if you happen to need medication that's stored in your locker. You will not be allowed to remove your phone, and during breaks, you will not be allowed to leave the premises. In addition to bringing all that, it's also recommended that you bring your authorization to test letter and the Prometrics receipt that you received when you signed up for the exam through Prometric. Theoretically, they should know you're coming because it's 2017 and we have computers, but it's always better to be safe than sorry. In addition, just recognize that you're going to be video recorded and monitored at all times, and Prometrics will be doing a walkthrough of your station at least once every 8 minutes. So every couple minutes, you're literally going to have somebody looking over your shoulder. So if you're a nervous test taker, you need to work on that before you take the test. Getting really deep into the format of the test now. The test is 250 questions, broken up into blocks of 50 questions. So once you go through an entire block and you're good to go with all the questions, you will submit that block and you will not be allowed to go back to the previous block. So you have 300 minutes or 5 hours, which works out to a pace of about 72 seconds per question, including a free 15-minute break, which comes after the second block or the first 100 questions. So at that time, the clock stops and you're allowed to take a 15-minute break. Keep in mind here, you're very unlikely to have the full 15 minutes. When you come to the break, you'll need to raise your hand. The Prometric staff will come and escort you out of the room, and you'll basically do a reverse check-in where you pull up your sleeves and everything. You get wanded. All of the jewelry and glasses and hair accessories you may have will be inspected for cameras, both going in and going out, which will reduce your actual break time. And then keep in mind too that it's probably going to be busy with multiple people taking a break around the same time, which further reduces your break time. So leave all your jewelry at home except for your wedding band, and even consider leaving that home because that's going to take a couple more seconds off your time. Consider wearing contacts if you have them, because glasses will be thoroughly inspected. The FSBPT is very, very nervous about things like Google Glasses. Hair ties and hair accessories and even bigger or longer hair will be inspected thoroughly. There's a funny newsletter that FSBPT publishes every so often about possible security threats, and the most recent one included being on the lookout for something called a Bluetooth wig. So any extraneous stuff you're wearing will be inspected very thoroughly and further reduce the actual amount of break time you have. While on break, you can get food and drink only from your locker and use the bathroom. You won't be allowed to take your phone out or any of the other personal effects in your locker, and you won't be allowed to leave and come back. That is, like, go to your car or leave the facility or whatever and then come back into the testing center. Throughout the test, you can take an unscheduled break whenever you want. So if you think you're really killing it and you have a lot of extra time, you can just stand up and take a break whenever you want and go through the same process. Of the 250 questions, only 200 are graded, but you won't be able to tell which 50 are validation questions, as they're called. And of those 200, you need a score of 600 out of 800 points to pass. Based on which version of the test you're taking, the number of questions needed to pass, the number of questions you get correct, can change. So it's called your raw score that's then converted to a scale score. So you will always need 600 points to pass, but the number correct you need to achieve 600 may fluctuate. So quote-unquote easier test versions will require you to have more correct answers needed to achieve 600 out of 800, although FSBPT says the versions only vary by 1 to 2 questions as far as easy and hard test versions. And unlike some of the other standardized tests you've probably taken up to this point, there's no penalty for incorrect questions. All that matters is maximizing the amount of correct questions that you answer. Taking the test, you may or may not be required to bring your own earplugs. Both the FSBPT website and the Prometrics website says depending on the test site, you may be allowed to bring your own soft earplugs with no wires or cords. So like the foam earplugs from the hardware store, or maybe something a little bit more sophisticated, but nothing with wires or cords, or they may provide you with noise-canceling headphones. You may or may not be allowed to chew gum. You will not be allowed to have a watch at all, and you cannot bring any food or drink into the actual testing room. You may or may not be allowed to stand up from your computer to stretch or practice movements related to test questions. It's very unlikely that they will tolerate you standing up and moving around, so you'll need to do everything you can from your chair. Speaking of your chair, once you are sitting down before the test begins, there's a tutorial, and it's highly recommended that during these few minutes of the tutorial, you really get your seat locked in for maximal comfort because you're going to be there for a long period of time. And just a reminder that you will always be monitored by video and recorded the entire time you're testing, and a person will be walking around almost constantly looking at what you're doing over your shoulder. And the FSBPT reserves the right to prevent you from ever sitting for the exam again in your life if caught cheating or manipulating the test in any way. So basically, you're at the goal line, so don't mess up now. The test breakdown. The content outline is published at fsbpt.org. So the current outline is from January 2013 to present, and it expires with a new outline being introduced in January 2018. So the vast majority of the test, about 87.6%, deals with questions regarding examination, evaluation, differential diagnosis, prognosis, and intervention of the musculoskeletal, neuromuscular, cardiopulmonary, integumentary, metabolic, endocrine, gastrointestinal, genitourinary, and system interactions. There are no questions about metabolic and endocrine examination, no questions about gastrointestinal examination, no questions about examination of system interactions, and no questions about interventions for system interactions. So a really good example of a topic that falls into system interactions is something like oncology or cancer-related questions. And the minority of the test, it regards medical equipment, therapeutic modalities, patient safety, research or evidence-based practice, and then professional responsibilities of a physical therapist. Some general strategies for test taking. When looking at the answers for a question, you should consider the patient's physiological needs. So the need for air and water always come first. Safety comes next. Well-being considerations, so function and movement, that sort of thing. And then finally, emotional and social needs come last. Always take a few seconds to identify the key words in the question. They are usually capitalized, so look for words like most, best, initial, first, contraindicated. So you may see a question that says, what is the best initial treatment for such and such patient? Identify answer choices that are opposites and then seek to eliminate them. If you cannot eliminate one of the opposite answers, that's usually the answer. Eliminate answers that deal with very, very rare, unusual conditions, body parts, or situations. Look for duplicate answers. So look for two answers that say the same thing in different ways. Those are easy to eliminate. And then identify choices that are equally plausible, as those can also most likely be eliminated. And then look for answers that address the emotional or well-being of a patient. So remember, that's the last thing we look at as far as patient needs. So choices that offer a patient An answer that is too positive, optimistic, or reassuring of an outcome can be eliminated. Something else to always keep in the back of your mind when you're answering questions is, what would the perfect, autonomous, independent doctor of physical therapy do? So the perfect PT would not miss anything on an eval, and the perfect PT would not wait until visit 4 to write goals. Always choose the most direct option of care. So avoid intermediaries. So if there's a question about a patient falling, don't choose an answer that says report the fall to a nurse or log into the EMR and type an incident report. The most direct answer is obviously to get the patient off the floor, back into their bed or chair, and then do the other things. Always choose options that include performing a direct action and documenting an event. So if there are multiple answer choices that all involve more or less the same action, but one also involves documenting the event, choose that one. So for example, the question says, you notice that your patient has very dark and very foul-smelling urine. What do? You report it to the appropriate provider and document it in your note. And do not escalate events beyond the appropriate level. So using that previous example, it's appropriate to report that situation to the nurse in charge of that patient, not to the medical director of the hospital, not to the president of the NPTE. So don't escalate events beyond where they need to go. And finally, just a couple caveats. Don't study just by listening to this. This is by no means the end-all be-all. This is something that I created for my own personal study use that I just decided to organize and record. Study whatever method has worked best for you over the past 7+ years of college. So if you're a visual learner, keep doing visual stuff. If you are a kinesthetic learner, keep writing and drawing. Don't just rely on this because it's easy and free. So consider this as just a supplement when you want to change up study styles or study types, or if you're like me, you're stuck in the car and you want to get some study time in wherever you can. And for rote memorization items, so later on in the podcast, when I talk about muscle actions or insertions, the audio track won't be skipping. I will repeat very boring, straight memorization stuff a couple times per item, nice and slow before I move on. Post NPTE, so once you're done, what do? So the report, according to FSBPT about your score, is theoretically supposed to be complete and available at fsbpt.org within 10 days. So the score gets transferred from FSBPT to the individual state, and then it's available for the test taker to view. Score reports are only available for 30 days on the website, so download and keep for your records, because after 30 days, if you need access to it, it's going to cost you $80. You can transfer scores to a different state also for $80, and for $90 you can purchase what's called a performance feedback report. So this is a more detailed breakdown of your test performance. It will also tell you which questions you got wrong and the rationale behind them. And finally, if you're taking the test while still in school, so if you are attending a program that lets you test early and you're still on clinical rotations, you are not a licensed PT just because you passed the board exam. You still need that diploma to finalize your license with your individual state. So you'll need to send in your transcript with what's called degree posted status to your state license board to then finalize your license application and actually be licensed. So that's it for the introduction to the podcast and the exam. The next episode will start with the musculoskeletal system. The outline for each episode, as I said, will be in the show notes. So looking forward to working on this with you together moving forward. And thank you for listening.